In the recently reopened states, cases are ticking up, and in Queensland, Omicron's fast becoming the dominant strain.
This is happening very rapidly, again, even more rapidly than we originally predicted. We thought that might take weeks.
While Victoria's numbers have remained stable, New South Wales's spike in cases has led to 34 more hospitalisations overnight.
Shouldn't that set alarm bells ringing?
There's always concern, but if not now, when?
The rationale is familiar.
Of the ICU presentations, 33, 26 of those people unvaccinated. Vaccination has been crucial.
But with the extent of Omicron's ability to evade vaccines still unknown, some of the key architects of Australia's reopening roadmap want our pollies to pump the brakes. In a joint statement, Professors Sharon Lewin, Greg Dorr and John Kaldor have called for a few weeks' pause on large indoor events, along with the reintroduction of mandatory indoor masks and other light restrictions.
The reality is we have essentially a new virus.
But as we emerge into the light after 2 gruelling years, those calls are falling on deaf ears.
We want to stay safe, but we also want to stay safely open so our economy can continue to grow and people can move forward with confidence with their lives.
We have one of the highest vaccination rates in the world and a very different set of circumstances. The direction of Australia is overwhelmingly towards opening up.
It is a time of personal responsibility for our state. We are treating the people of our state like adults.
So as our pollies plough ahead, do they know something our leading experts don't?
Well, John Kaldor is Professor of Epidemiology at the Kirby Institute, based at the University of New South Wales, and he joins us now. Professor, our leaders are steadfast in arguing that Omicron's likely to be a more mild COVID variant and that our vaccine coverage is among the best in the world. So with boosters on the way as well, do you know something that they don't?
Lisa, it sounds like they know something that I don't. Because, there's certain parts of that statement I agree with. We've got very good vaccine coverage and boosters are on the way. The question of whether it is a milder disease, I think the jury's still out on that one. We have very early evidence and particularly whether the vaccines protect as well against this variant as they have against Delta. So that's information that is still being accumulated.
Do you think the public will buy into what you're proposing right before a seriously hard-earned summer holiday?
Well, look, what we're talking about is nothing like the sorts of what we refer to as lockdowns that have been experienced in our big Sydney and Melbourne. What we're really trying to say is that this is a variant that is clearly spreading very, very fast, and there are a number of things that we can do to slow that spread that are not particularly major impositions on the community at large, and those things can really help us buy time until we find out exactly what is going on with this new variant.
John, right throughout this pandemic, Australia's politicians, the ones in power, have been pretty much in lockstep with the leading medical voices around a lot of the public health measures, but there seems to be a parting of the ways at this juncture. How do you explain that? What's changed that means that folks like you and Sharon Lewin are saying something very loudly, very clearly now, and the politicians are going, you know what, we know better?
I think maybe what's happened is that there was a huge amount of optimism around the high level of vaccine coverage we achieved, which was justified optimism, and we headed towards Christmas with the notion that we would be back to a pretty much normal state very soon. But with many things COVID, it changes, and there's this new version that we just don't quite understand enough about, and we really need to get a clearer understanding of it and buy a little bit of time, put a little bit of brakes on transmission so that we can do that. I think the community would be very supportive of that if the message is conveyed very clearly as to what's going on. This is not a return to the lockdown era.
You're essentially asking premiers to consider shutting down large gatherings in pubs and nightclubs, places where people will be celebrating over the Christmas New Year period. Can you see why that's so difficult for a leader now to respond to in the way that you want?
it is a difficult time of year. It's not popular. On the other hand, it's the time of year when we have the biggest risk that this might actually translate into something bigger if we don't put the brakes on a little bit. But also, the idea that we have to shut everything down is not necessarily the case. There are different ways to limit or restrict the degree to which exposures can take place in these settings without actually shutting them down.
And what could happen if we don't?
If it turns out that this is a very mild variant, fantastic. We're in a very good situation. It turns out the vaccines are very protective. That's wonderful too. But on the other extreme, if it turns out that we let transmission go the way it is now, and it has been increasing pretty steadily over the last week or two, and it turns out that the vaccines aren't as protective as they had been for past variants, and it turns out that the proportion of people who actually get sick is equivalent because the vaccines haven't protected them, then we could be seeing a return to the phases that we saw a little bit heading towards in Sydney, but certainly in Melbourne last year, where hospitals are really quite burdened with people entering and requiring care for COVID.
It's a heck of a learning curve to be on, particularly at this time of the year. John, thanks so much for your time.
Well, I hope that was helpful. Thanks, Lisa.
It's great to see the Professor acknowledge the uncertainty about that claim that people are making that this is a milder variant, because part of the danger is until we know for sure, what we don't want to do is make people complacent about this virus thinking, it's just milder. Now, the wave we are seeing is milder in terms of hospitalisations, maybe because it's a milder variant, maybe also because it's spreading in communities where people have been vaccinated or previously infected. So that's good in terms of vaccinations. And the message we need to push is that people need to get that booster.
Is part of the problem or the challenge now with all the public health messaging and responses is that we all want certainty, but actually the medical profession, the scientific community can't really give it.
Exactly. We can't afford wishful thinking when we're seeing cases rise as fast as this. It may end up being like this, but I was hoping that a couple of years into this, we'd be a bit better as a community and leaders and in the media of acknowledging uncertainty and sitting with that uncomfortableness for just a couple of weeks until we find out.
But see, politicians aren't going to do that, do they? Because they know the greatest gift that they could give as politicians at the moment is to give us Christmas. So they're
you don't want to be the politician that destroyed Christmas.
Well, they tried that last year, probably didn't go down too well.
It's not a
probably
vote
saved
winner.
quite a few lives. But at this stage, as the professor just said, there are still so many ifs.